Welcome, everyone. Welcome, people of faith, volunteers, those of you who are making such a big difference in your communities. Thank you for joining us via this video conference. Many of you, once again, we did this last week, and I got a lot out of it, and I hope that all of you did as well. And it's particularly tough because those of us who are people of faith really like grabbing each other's hands and arms and hugging each other, and with the social distancing that we're having to practice now and the fact that we can't come together physically, that makes things doubly hard for people like us. Not being able to hug my daughter when she came home from school a few weeks ago, that was hard. But it's necessary right now, and it's a time that our spirits can go into overdrive, talking to each other more than we ever did, and showing each other that we care, and having to put things in words. I think it's important for all of us. These are extraordinary times, and I'm so grateful for the faith leaders in our state, for the nonprofits, the volunteers, the people who have spent most of their lives caring for and helping other people. I know that all of you feel a tremendous burden with your congregations, with your organizations, with the people that you're helping. You feel that burden all the time anyway, but now you know that everybody's hurting. Now you know everybody needs you. There's a person who just lost a job. There's a person who is standing outside a rest home waving to their mom through a window because she can't visit. There's somebody who doesn't have enough food because they can't get outside the house. They're afraid to. They may not have enough money. There are people who just have lost contact with the outside world. And today in North Carolina, there are grieving families because we've had 2 people die today. A man from Cabarrus County in his 70s, a man who lives in Virginia but was passing through North Carolina, fell ill and was hospitalized here. He also died last night. Our hearts, our prayers go out to their families. It is a stark warning that this illness is serious and that it can affect those who are older and more at risk in a way that is terrible for our families. And there are a number of people now in our hospitals who lay critically ill with this virus, and the families are sitting outside of the door. They can't go in and hold the person's hand. If there is ever a time for God, if there was ever a time for faith, if there was ever a time for relying on each other, it is now. My administration has had an Office of Public Engagement that tries to bring all of our various agencies together, public-facing, and I know that many of you have worked closely with Jeremy Collins and his team, registering your concerns, giving us great ideas, and I have been very fortunate to have good people working and continuing to work. I think right now, as leaders in our communities, not only do we have to talk about the things that we need to do, we need to show people the things we need to do. Ourselves, we need to practice social distancing. We need to make sure that our employees, people who work with us, people who work around us, are practicing social distancing. Making sure that we stay at home as much as we possibly can, particularly those who are in the high-risk category. It's important now, particularly with the advent of social media, that people have hard facts, that we know the truth. And you can go to our NCDHHS, that stands for North Carolina Department of Health and Human Services, NCDHHS.GOV/coronavirus, for a wealth of information that is truthful, that you can help spread out to your organizations and to your congregations. You can also text COVIDNC to 898-211, and they will give you advisories as they come out, several a day, to give you good links like our 211 that'll connect you with all kinds of resources. That's important to have, because we know that 80% of the people who contract this virus will not need to go to the hospital. Some will be really sick at home, and some will have a few mild symptoms, but 80% won't have to go to the hospital. That's good. Our problem we face is that 20% of the people will. And we're working now on supplies, making sure that we have available hospital space, working to establish additional hospitals if that's necessary, because we want to try to stop the spread of the virus as much as possible, but we also want to be able to care for people and to make sure that they get proper medical attention. Our administration is working on that 24/7 at our Emergency Operations Center. I'm grateful for all of our frontline healthcare workers, our law enforcement, our emergency responders, our teachers, our school personnel, our people who are working in grocery stores, who are working in these essential businesses across North Carolina, and who are risking sometimes when they are doing that. I'm so grateful to them. And I'm also grateful to our spiritual leaders, the people who make sure that we keep our spirits as high as they can, make sure that we have the confidence that we need to go forward in the day, making sure that prayers are prayed and that we continue every single day with peace and hope and love among each other. I'm so honored and humbled to be your governor. Sometimes I wake up in the morning and say, I didn't sign up for this, but yeah, I did. I signed up to be the leader of the state where I grew up, the state where I love, the people that has people that I love, and I'm just honored to have this opportunity, and I'm going to give it my best every single day. I need you. I need your prayers, and you certainly have mine. And we're going to work every single day to make sure that we get through this, and when we come out on the other side, I want us to be better than ever. We're finding new ways to get internet access to children. We're finding new and different ways that we can provide school nutrition to children who need it. What we're going to do is learn from this crisis, and we're going to make everything better at the end of the day because of it. And I promise we're going to work on that every day. Thank you for being here. Thank you for what you're doing in your communities. It is time to heal the sick. It is time to feed the poor, feed the hungry. And it's time for all of us to step up and do our part. I'm grateful. God bless you. Thank you for being part of this conference, and thank you for what you're doing every single day. And I'm going to turn it over now to my Director of Public Engagement, Jeremy Collins. Jeremy?
Thank you, Governor. Thank you all for joining us this afternoon. My name is Jeremy Collins. I serve as the Engagement Director for the 75th Governor of the State of North Carolina, Governor Roy Cooper. As you can see on his face and you can hear in his comments, he's working very hard along with the rest of the team, all of our cabinet secretaries, all the state employees, cabinet agency staff, to fight this terrible pandemic and COVID crisis that's sweeping across our state and country. The purpose of this session is to bring together our faith, our nonprofit, our volunteer, and our Divine Nine communities. We want to share information with you, but we also want you to share information with us. And so during this time, we'd ask that you access the YouTube stream or the WebEx stream and ask us questions real time. We have epidemiologists who are standing by to answer health-related questions, and we have government staff standing by to answer any of our leadership questions. The Office of Public Engagement under Governor Roy Cooper is not just a one-way exchange of information. It is a clearinghouse, a space where information can be shared to the benefit of all of our communities. With that said, I'm going to let you know a little bit about how this is going to go today. When I step down from the podium, behind me will be Mr. Benjamin Money from the North Carolina Department of Health and Human Service. After Mr. Money will be Ms. Caroline Farmer, Director of our Office on Volunteerism and Community Service. Then there'll be Brother Tony Knox, the immediate past Grand Basileus of the Omega Psi Phi Fraternity Incorporated, followed by Ms. Jessica WHICHARD, who's with the Food Bank of Central and Eastern North Carolina. Next will be Pastor Lisa YEBUAH, the Southeast Raleigh Table, and then I will come back and give any last comments and answer any questions that may have been very frequent in the webcast. Again, I want to thank everyone for being with us today. We're going to be doing this weekly. We want to make sure you've got up-to-date information. The governor mentioned our North Carolina Department of Health and Human Service website. That web address is NCDHHS.GOV/coronavirus. There you can find a toolkit that will keep you up to date on as far as a ticker on where we are in North Carolina, but any resources or information that you might need to know. With that said, I will now invite up Mr. Benjamin Money from the North Carolina Department of Health and Human Service. Thank you.
Thank you, Jeremy, and thank you, Governor Cooper. Let me thank all the mosques, synagogues, churches, temples, and other places of religious practice that heard our call last week and moved their services online. We know the sacrifice that is required, and we appreciate your commitment to the health and well-being of our state. I also wish to thank the civic and volunteer groups joining this webinar for supporting our efforts in assisting families as we work together to curb the spread of COVID-19. As of this morning, in the United States, there are over 44,183 cases of COVID-19 that have resulted thus far in 544 deaths. In North Carolina, there are 504 diagnosed cases of COVID-19 in 53 counties. And as Governor Cooper just mentioned, sadly, we've had our first 2 deaths from the disease. 2 weeks ago, the World Health Organization declared COVID-19 a global pandemic. As we look across the world, and even in the United States, we see a rapid spread in the transmission of the virus. We are in constant contact with our colleagues around the country to assess the mitigation strategies that they've taken to curb the spread of this disease. The focus the last few weeks has been on contacting and quarantining travelers and individuals with known exposure. We have also focused on testing as many symptomatic people that have tested negative for the flu as possible and isolating those who were positive. North Carolina has been a leader in testing. In fact, one of the top 10 states in the country. We have tested more than 8,400 people with thousands more samples collected and results pending. This means that we now have a snapshot of COVID-19 in North Carolina. We now know with certainty that we do have community transmission, meaning that we don't know how some people are getting COVID. This is a role that testing should play in the first phase of an outbreak. When we confirmed community transmission last week, it now means that there's someone who is catching the virus without having contact with a known carrier. You may have heard references to flattening the curve. This is a proven strategy to limit the contact between people to slow the growth in the number of people getting infected. This idea is that if everyone gets sick at the same time, the healthcare system, our hospitals, our emergency rooms, our intensive care units would be overwhelmed. So we need to slow the spread of the infection so that hospitals and health systems have the capacity to care for those in most acute need. This strategy, however, requires that we move quickly. And the measures the governor has taken use the strongest weapon we have at the moment to fight COVID-19, and that's social distancing. We are working with our physician community on how best to respond to COVID-19. Secretary Cohen has spoken with thousands of doctors, leaders, and others from across our state. Our physicians and our other clinicians are really true heroes. They know that this is an unprecedented pandemic that will take new ways of interacting with patients. We're making a big emphasis on telephone and video appointments, creating new ways of protecting patients and providers, following the up-to-date guidance on what protective equipment they should use in different settings, and looking at new ways of leading in our communities. Along with doctors and other clinicians, we share the concern about not wanting our patients to come to places where they get sick. That is why we're one of the earliest states to make mandatory limits on large gatherings. And we went even further when we closed public schools and now extended that closure, mandated limitations on visitation to nursing homes, closed bars and restaurants, and other places where social distancing is not possible. If you can telework, we encourage you to do so. The more we practice social distancing, that is staying 6 feet apart, washing our hands, coughing into our elbows, the better position we'll be to fight this pandemic. We expect that folks in North Carolina are going beyond our mandates and doing their part to limit the spread of the virus. We must be particularly vigilant for those who are at higher risk for severe illness. This is a new disease, and we continue to learn about it as new information becomes available. On Monday, the Centers for Disease Control updated those at greatest risk to include people over 65 years and older, people who live in a nursing home or long-term care facility, people with high-risk conditions, including chronic lung disease, or moderate to severe asthma, or heart disease with complications, people who are immunocompromised, and people of any age with severe obesity or certain underlying medical conditions, particularly if they are not well controlled, such as individuals with diabetes. The Centers for Disease Control also advises that women who are pregnant should be monitored since they are known to be at risk with severe viral illness. However, to date, data on COVID-19 has not shown an increased risk. While children are generally at lower risk for severe infections, some studies indicate a higher risk among infants. This expanded definition for high risk further emphasizes the need for each of us to do our part and commit to social distancing. We are working on additional interventions that we can do here in North Carolina to protect our higher risk community members. And for those who might think that they have COVID-19 and have mild symptoms, the CDC now recommends that you stay at home. Call your doctor to see if you need to be seen at the office or another setting. Just a reminder, the vast majority of people who get COVID-19 will have mild illness and recover at home. Your doctor, your local health department, or your community health center can help you determine what the best course of action will be for you. As I said earlier, the experiences from other countries and other states that are further along in this pandemic indicate to us that we need to assure that people don't get sick at the same time. We need our medical systems to be here for everyone who needs care. This is really a measure that's about saving lives. We also have to acknowledge that social distancing is difficult in some settings and virtually impossible in critical settings like childcare. So families, you can do your part. Many families have chosen to keep their children at home, and if you are able to do so, we encourage you to keep your children at home with you. However, as I've stated before, child care is a critical service. We need those who are working in our communities to be safe and healthy as part of the state's COVID-19 response. We need those folks to have access to safe, quality child care so that they can be at work knowing that their children are being well cared for as they care for others. This week we sent out updated health, safety, and operational guidance to child care programs, so that they will be able to stay open and so that they can best protect the health, safety, and well-being of both the child care workforce and the children and families they serve. We know that the child care industry, like many others, is struggling financially. We are also actively pursuing options to provide financial assistance, support child care programs, in order to assure available child care for families who need it during this crisis. We also know that social distancing is very difficult. The disruption in our daily lives is leading to isolation and fear in many of us. Unchecked, this can give rise to anxiety, depression, and other mental illnesses. It's important that we take care of ourselves. So go out and take a walk, maintain social distance when you do it, give yourself a break from the news, check in with your neighbors, your friends, and family, and do it by video or phone. And there are also professionals that are ready to help. Many behavioral health clinicians in North Carolina are ready to take new patients and provide care over the phone or by video. Their contact information and other resources is on our COVID website under Managing Your Overall Health. Just remember, we're going to get through this, and we each need to take advantage of the opportunity we have to help one another and utilize the help that's available to us. We also need your help to curb some of the selfishness and stigma that's been caused by this pandemic. It's important to remember that just as no one is immune to this virus, there is no one group of people that is responsible for COVID-19. This is a time that can bring out the worst in people, but we need you to help us bring out the best in all of us in North Carolina. Just remember, grocery stores are open, so there's no reason to hoard food, medicines, or personal protective equipment. Also, help us with misinformation, because there's a lot of misinformation and confusing messages out there. DHHS and other state agencies are coordinating our response and aligning our public messaging with the Federal Centers for Disease Control. As Jeremy mentioned, as well as the governor, we have a number of resources available on our website for you to use. We also encourage you to dial 211 if you need information and assistance regarding COVID-19. Our website is continually being updated with information, new guidance, executive orders. We also have established a method of recruiting medical, healthcare, and emergency response volunteers called NCTERMS. That stands for North Carolina Training Exercise Response Management System. And there's a link to that on our website as well. It's important to remember if you're having symptoms to call ahead before you go to your healthcare provider. If you're not in distress, don't go to the emergency room. Also, don't call 911 if it's not an emergency. DHHS is working to support homeless shelters, standing up feeding programs, and a child care provider web forum. The focus is on pairing health systems, first responders, and others to assure that they have that they have child care needs to support their efforts in providing us health care and other necessary services. We're communicating with other states to make sure that we're not missing any options or approaches in meeting the needs of our most vulnerable citizens. DHHS also provided homeless shelters with additional guidance on top of what was provided by the CDC and HUD. Shelters need to have conversations with their local emergency managers regularly. Shelters that have diversion dollars should be thinking of ways to use those resources to help prevent exposure and reduce families from going into the homeless system. DHHS guidance was also given to county DSS directors regarding their public-facing programs and services. Even though some DSS offices are not fully staffed, their capacity to serve has not changed. In conclusion, I want to thank Civic, faith, nonprofit, volunteer, fraternity, and sorority groups in particular who are participating in this webinar. We thank you for staying engaged, for keeping up with the facts, for dispelling misinformation, and supporting our communities during this pandemic event. At this time, I'd like to call up Carolyn Farmer, who's the director of the North Carolina Commission on Volunteerism and Community Service. Thank you.
Thank you. Good afternoon. My name is Caroline Farmer. I am with the Commission on Volunteerism in Governor Roy Cooper's office. You know, our world has changed in the last 2 weeks, and it's not going to go all the way back the way it was. But that doesn't mean we need to change who we are as part of that. So those of you who have already stepped up and are helping your neighbors, thank you. We're going to need more of you. We're going to need you locally, and we're going to need you communicating. I do just want to say for just a minute to acknowledge the fear and the heartbreak of hearing about the 2 deaths that we've had in this state. This is the kind of thing that makes us all want to go home, close the door, keep our families safe, and not go out again. I understand that. I understand that that's how your members feel. And I want them to be safe. But I also want them to be safe and help their neighbors. So please don't let the fear paralyze you, paralyze your members. I want you to think about how you can help, especially those that are unwanted, unloved, and uncared for. I want you to coordinate locally. I don't care if you don't agree about faith, much less basketball, with the people down the street. I want you to work with them. I don't care if you've never met them or talked to them before. It is going to take every single one of us working side by side, well, 6 feet apart, making sure that we help those people who most need help. So organize a local committee. Make sure that the people you have in your community that need services are getting services. And let us know what you're doing at the state level. You see, I have the volunteernc.org website is up there. Our contact, our email is also volunteernc@nc.gov. So that way you can contact us and let us know what your needs are. What is it that you're doing locally? What are you coordinating? So we can make sure that you get the best resources possible. Second thing I want you to focus on is recruiting volunteers, healthy volunteers, the ones that are not at risk, and make sure that they are able to get out and serve the different communities that are providing the food and the shelter that we need. Third thing I want you to do, check on your neighbors, check on your members. And I don't mean just the ones that are homebound, that are at risk and can't get out. I want you to check on them, but also think about the ones that are divorced or isolated or single parents. Think about the children. This is very traumatic for children. They need some caretaking as well. And so be creative. Think of some online ways, remote ways that you can reach out to that population as well. Plus, it'll make the parents very happy. So I want you to lead your neighbors, helping neighbors. If you can't do anything else, make sure those people who need to know that you may not be able to help them with whatever their problem is, know that you care about them and you're here for them. So make sure that they know that they're not alone and you're here to help. So on behalf of Roy Cooper, thank you very much.
Good afternoon. I'm Dr. Antonio Knox, the 40th Grand Boss of the Omega Psi Phi Fraternity. On behalf of Dr. David Marion, the 41st Grand Bosses, and the Council of Presidents, we'd like to thank Governor Roy Cooper, the Cabinet, and all those who have been stepping up to make a difference and to keep those citizens of North Carolina safe. We recognize that this is a very different time. We recognize that life as we have known it is different. But because of the fact that we trust in him and lean not to our own understanding, we know that this is a temporary situation. We recognize that now is the time. Now is the time for us to come together. It doesn't matter what organization you're in. As a member of the Divine Nine, Now is the time. We have always come together about things that matter. Well, now is the time, and not just the Divine Nine. We must come together with all social and civic organizations because we are all in this together. There are many who will be impacted in our organizations. We recognize that there are some who will be out of work. There are some who may have some sickness. There are some who work and volunteer with nonprofits will have to make some tough decisions. But now is that time that we've been chosen to step up and lead. We must make sure that we do the simple things that we can do to help each other. We're all in this together. There's no discrimination. It doesn't matter what color you are, what color you wear, what organization you're in. This impacts us all. And as the citizens of North Carolina, we must stand in solidarity with the governor and those experts who are advising us on what to do. We cannot participate in misinformation. We must recognize that we must go to the websites that we've been provided. We must get the proper information and use our expertise to be able to share. And there is a time, as Ms. Farmer just said, that we must volunteer. Service is a part of the mission of every one of our organizations. And now is the time, as we recognize that there are things that we can do. There are the homeless. There are those who won't have a meal if they're not in school. We must make sure that we assist in providing those opportunities. We must make sure that those who don't have an opportunity to go into work, whose businesses are closed, that we find a way to support them as we always have. While we have canceled meetings and we have canceled the way that we have some of our community service projects, those are temporary measures because we will come back and we will do things in the community and we will make that difference that we always do. But now is the time that we must come together and do the things that we're being asked to do. The simple things. We must cover up when we cough. We must wash our hands, the social distancing. We must stay at home. We must recognize that this pandemic, it can affect anyone. There's no such thing that it will not affect you if you're a teenager. It will not affect you if you're a college student. There's no such thing. We must all recognize that we play a role. We most certainly don't want to be a carrier and have a senior that becomes ill. We most certainly don't want to be a carrier and have a child that becomes ill. So we must follow the guidance that's been given to us. We have an opportunity now to really show that when we come together, we can make a difference. While there are so many that look to the Divine Nine and look to the leaders of the organizations, now is the time that we must demonstrate that we are responsible, that we are the leaders, and that if we can influence our young people to stay at home, if we can influence them to do positive things, now is the time that we must do that. Because together, we can defeat this. And there's no doubt in my mind that we will defeat this. The governor and his staff has given every effort that they can to make sure the citizens of North Carolina are safe. And now is the time for us to be there for them, to make sure that we do what we can. We thank all the healthcare workers and those out on the front line. We thank all the volunteers for all that they're doing. We thank the preachers, all the ministers for what they're doing. As we look around, the Lord has given us this chance to recognize who we are and to recognize that we are one and that we must all come together to be able to defeat this pandemic. And we will. Let's stay at home.
Good afternoon, everyone. I'm Jessica WHICHARD with the Food Bank of Central and Eastern North Carolina. And I want to say thank you to Governor Cooper for his leadership and his support of the nonprofit community as we continue to operate and change the way that we operate in this crisis. The Food Bank of Central and Eastern North Carolina serves 34 counties. We're one of 7 food banks in the state, and every county in North Carolina is covered and supported by a food bank. So I want to make sure that everyone knows that they've got a food bank in their corner. Like many of you, we are changing our operations. We've been around since 1980, and we've never faced something like this before. Despite the hurricanes and the storms, this is different. And so we're taking a really good look at what is needed, what we're hearing from our partner agencies on the front lines. We're changing some of our models of distribution. We're bringing in more dry food. We're packing large boxes for families to make sure that perhaps those who haven't needed the food bank before can receive support from us. And we're working with new partners, making sure that we're seeking out the groups who are supporting the most vulnerable people right now and making sure that they know we're available and that we're a resource. As Caroline mentioned, we still need volunteers. We're taking the guidance very seriously. We're limiting this to small groups. We're making sure that as boxes are being packed, people are spaced out. But if you're healthy, if you're not part of the most vulnerable populations, I'd really encourage you to visit our website. That's foodbankcenc.org/volunteer. We've got slots. We're really making sure that we're taking everything seriously, but we need those boxes to be packed to get food out into the community. And we really appreciate those who are able to make a difference and spend an hour or two with us where they can. And mostly I want to say thank you to all of you. I see you in our distribution centers changing your own operations, doing door-to-door service as opposed to serving hot meals, coming in, wearing gloves, wiping everything down, but taking what you need to get out into the community and serve the people that you know are in need. And I know that it's not easy, and I know it's hard to balance the guidance that's going out there with the need to serve. And I just want to say thank you so much for what you're doing, for your dedication, for your heart, and really being on the front lines and serving people every single day. It's changing lives one at a time. It's making a huge difference and making sure folks don't feel forgotten. And we're so, so thankful for you. For more information and updates about the way we're changing our operations, particularly as guidance changes community by community, you can visit foodbankcenc.org/COVID-19. And that will kind of keep everyone up to date on what we're doing, the impact that we're having, and ways that we're trying to change our operations again to make sure we're serving folks who are most in need. Thank you so much. Thank you for letting me be a part of this. I really appreciate it.
Good afternoon. My name is Lisa YEBUAH, and I serve as the lead pastor of the Southeast Raleigh Table, and I'm a proud member of Alpha Kappa Alpha Sorority Incorporated. One of my favorite writers, her name is Macrina Whitaker, she says this, that joy and sorrow are sisters, they live in the same house. And her sentiment is that as human beings, we oftentimes have to hold lots of competing realities. And as we are traversing through this pandemic, we feel the weight of that we're holding lots of realities. On one hand, we are seeing unearthed the beauty of the God goodness in humanity, how people are being incredibly creative in the ways in which they connect with one another, how folks are beginning to kind of cultivate the art of neighboring, how people are choosing to have an expansive heart as opposed to hoarding their resources. Just this past week, elementary age school children at my church community FaceTimed preschoolers in my church community so that they could read them books over Zoom and also over FaceTime. In the midst of a crisis, people are choosing to come home to their best selves as humans. But this is also what's true about this pandemic. It's that it's also exposed many of the inequities in our communities, where we are living with the weight of how many children live in food insecure homes. We recognize the weight of the healthcare disparities that we sometimes feel and recognize in our communities. Or that even as some students were packing up their dorm rooms, that they did not have a home to go as their semesters came to an end in a particular way. I want to name as a faith leader who believes so deeply in the resurrection power of God that holding all of these realities in this season can be incredibly overwhelming. So I find comfort in this story in the Old Testament of a man named Naaman who found himself afflicted. And Naaman didn't know where to go in order to find healing. And he receives this word from a prophet that he just simply needs to dip in a river and he was going to be healed. Well, this is the interesting thing. When Naaman got that word from the prophet, Naaman scoffed because the word of the prophet was so simple that all he needed to do was just bathe in the river. And the prophet says to Naaman, Naaman, if you had been told to do something difficult, would you have then done it? Well, I want to just offer up this charge to us that we have been given these very simple instructions to stay at home. And I know that because many of us as faith leaders, our very livelihood is embodied in us being incarnational, literally being with the people that we love and care for, that instruction to stay home might feel like a passive act. But I'm going to invite you instead to think of it this way, to reframe staying at home as an act of love, an act of hospitality, and an act of justice. That whenever I choose, yes, maybe to be inconvenienced and stay at home, or not have friends come over, or to do the things that I love to do, that it's an act of love, an act of hospitality, and an act of justice for the elders in my community who are most vulnerable. That it's an act of love, an act of hospitality, and an act of justice for school children in my neighborhood who I know that for them, school is a place of refuge and also of affirmation. That it's an act of love, hospitality, and justice for those who do not make maybe a living wage or who have to depend on an hourly wage in order to provide and care for their families. That in that simple instruction of staying at home, that maybe indeed we unleash love, hospitality, and justice in such a way that we flatten the curve and we reduce the spread of COVID-19. Now, that doesn't mean that we ignore those who are vulnerable in our midst or that we pretend as though there aren't some really weighty issues in our midst. But as Mother Teresa one time said, that sometimes when we feel so small in light of all that is great in this world, that we're like a tiny pencil in the hand of God, but whatever God writes beautifully. Might we believe that in living in this way, of maybe just changing our patterns and staying at home, that maybe God would write something beautifully through us as an act of love, an act of hospitality, and an act of justice. May it be so.
Thank you all for staying with us for this time. I want to just leave you with a few closing updates and remarks. A moment ago, just as Brother Ben Money was stepping down, he said, I know I gave a lot of information, but a lot can happen in a week. And I actually would amend that a little bit to say that as we're dealing with this COVID-19 issue, a lot can happen in 6 hours. A lot can happen in a day. It's our purpose here to be good stewards of your time, but we want to share as much information with you as we can. I know the HHS website is posted with the coronavirus link on it to allow you to get as much information as you need. But there's another side of this. As we're dealing with the coronavirus issue, the governor's office, all of our agencies, the food bank, the Divine Nine organizations, the churches, and the volunteer and nonprofit organizations, we all have missions. We all have work that has to be done. The state keeps moving. People keep living. If you think about it, everything that we're asking you to do is actually to preserve life and preserve it more abundantly. I'm caught by a few things. I've said a few times, here we are again, once more in a place where we need each other now more than ever. I think you've heard folks say that several times. This inextricable, unmistakable bond that we are in, that we cannot untie, where one of us relies on all of us. Pastor spoke about hospitality and what it's going to require for us to make it out of this. No one of us will make it out of this unless we all make it out of this together. Reminds me of Dr. King, who said, this injustice anywhere is a threat to justice everywhere. In this health context, our office is asking you to be responsible because your selfishness, your inability to follow guidelines or restrictions do harm other people. Many of you have had questions about a few things that I just want to make sure that I address, at least as straightforwardly as possible. I get hundreds of calls every day about, is North Carolina going to lock down within the next hour? Is it going to happen at 2 o'clock? Is it going to be on Thursday? Let me answer that question as best I can. The answer is we have not made a decision on North Carolina locking down. If you hear some rumor that says it's going to happen Thursday at 12 noon, please disregard that. I can't say that North Carolina won't move into a more restrictive shelter-in-place situation, but we don't have that yet. We don't know what that's going to look like, and I can promise you that we will do all we can to let you know as soon as the data and the health experts and the leaders come to that conclusion, we want you to be as much a part of that conversation as possible. But I want to answer that just directly because I know it's on a lot of your minds. A lot of you are wondering about what is an essential business and what is an essential employee and what does this mean for my child's health care place. I want to just sit with you in a minute in that space to say that I'm a parent, that I'm a person who works, that I'm a person who depends on child care, that my family and our families are connected even in that space. So as we're working through this around this governing table, we also bring you and your voices and your families and your children into that conversation. So I can pledge to you again, as soon as we have come to a better decision about that, not only will we let you know, but we'll do as best or as much as we can to include you in that conversation. The other question I get most from our community is, what does this mean, this prohibition on gathering and restriction on gathering, and what does it mean for the church community, and what does it mean for our Sunday morning services? And I'll answer that very straightforward. What it means is protection. In the text, I've heard many of us talk about kind of what it means to be able to come together. And in my faith tradition, what I've heard a lot of folks say is, what about our gathering? What does it mean that when we're restricted from gathering together? And in the holy text to which I ascribe, in the context of gathering together and there God is in the midst, there's two major themes in that place. One, it starts out actually talking about children, about how we treat children, and about how we are to be humble and to come before God as a child. But just after that scripture, it talks about forgiveness. And forgiveness and youth are some of the most pure attributes in our community. Our desire for you to protect yourselves, to protect your families, to live long, to be able to prosper, to live in abundance is a pure thing. We don't want you to not have service, to somehow restrict your motion. We want you to not gather in a physical place because we know there the pandemic can spread even quicker. We want you to gather in spaces like this. We want you to think creatively about how communities can connect, but not at the expense of any one or two lives. So I want to answer that very directly as far as gathering, but then I want to move on to, are there any resources for churches? Churches don't fall in the SBA kind of loan category. So what can we do to help churches who have employees, and what can we do to make sure that churches are not terribly hit in this process? And what I can say to you very directly is, we don't have all the answers for that. We acknowledge that there are some gaps. I think what this thing has exposed to us is that we need a plan for how we live a more just and equitable life. Because it's true, I wish that we had an answer, and I wish that there was a box to check that said churches are covered in this way, in the same way that a corporation is covered, or a nonprofit in the same way that a volunteer organization. But the truth of the matter is we don't. What I can tell you is that my office is working with leaders across the state, and we're going to be tapping you to form a council that will allow us to address those issues from a community-led position. I've asked for several folks who we work with on a regular basis, and we'll be drafting others to step in and kind of help us think through these weightier matters, but not just think through them, but to communicate them in a way that is helpful and beneficial to all North Carolinians. Finally, I want us to remember the people who were living in a pandemic even before this. The marginalized, the downtrodden, the oppressed, the incarcerated, the poor, the hungry. Those people are experiencing this pandemic in an exponentially dangerous way. When we talk about doing justice and loving mercy and being of service, what it requires is to treat those persons who are living closest to the margins in the same way that we would regard a child. We have to care for them because society, and it may even for any number of reasons, has already pushed those communities to the edge. How can you help us? I want you to go to our website. governor.nc.gov, and there you can sound off and let us know when we talk about resiliency and recovering better than the way we are right now. The way we do that is with your ideas. So I want you to go there and tell us what it is you're experiencing. Tell us how we can craft a way forward that leaves us better off than the way we came in. To live through this pandemic and this tragedy and go right back into the same ways or same traps that we had before would be a tragedy. It would be a tragedy not to put in protections that create opportunities for more communities. That's what the governor works for every day, more opportunities, healthier living accommodations, better education, more money in folks' pocket, the opportunities to live a more purposeful and abundant life. That's what we work for. That's what I'm asking your help for. So if there are ways that we can do that, I want you to visit our website, governor.nc.gov, and tell us the ideas and things that you would like to recommend that we do. And we will continue to lift those ideas in our discussion tables, but also to stay in contact with you as we do it. I will invite you now to be on the lookout for this webcast and teleconference next week. We'll be doing it next week, Wednesday at 3:30. I'll be sending you an email on Monday, likely. Anyone who's participating here who received this email about today's gathering, I'll be sending you an email early next week with more resource information, as well as how to get connected to our session next week. We want to stay in touch with you. If there's information that you're not receiving that you want to see that you want to see more of, I'd ask you to go to that website, drop it in the comments, let me know. It does come to me, and then we can continue to give you the information that you need. I'm thankful for every person who presented today. I'm thankful for all those who joined us. I'm humbled at the opportunity to get to serve you and work with you. And on behalf of Governor Cooper, as he would say to us, let's keep working to move all of North Carolina forward. Thank you all.